Hello. Hi, good evening,
Hi,
everyone.
good evening.
Good evening, Dr. Anita. How are you?
I'm fine. How are you?
I'm good. Thank you. So, hello, everyone. How are you? Okay, so I think how many people have joined? Okay, 150 people have already joined around. All people will be joining live in YouTube. So, okay, so guys, let's start. Let's not wait. So, first of all, I want to thank you all for joining this wonderful webinar where we are, talking about where we are going to talking about, board certified pharmacotherapy specialist (BCPS), and we'll have Dr. Anita with us to clarify all the doubts, whichever you have, okay, or whichever you have shared in, the registration form. So before that, I would like to, tell about us. So we are CliMed Research Solutions. We are actually the CRO, and we are here in the industry for 3.5 years. And 3 years back, we have started our educational services as a part of our CRO, the Contract Research Organization. And till date, we have conducted around, we are running around 100 plus courses, 100 plus skill development courses, and 100 plus, courses for medical, pharmacy, and nursing, short-term, long-term courses still. And we are running almost all the courses, more than 50% of the courses free of cost, only on the technical charges of 100 or 200 rupees for everyone, these 3 months courses, 6 months courses. And there are some special courses as well. So, in that row, we are coming up with a very wonderful course we have launched already. So guys, I want to take you through this upcoming course for a minute. So as you can see here, we have come up with this wonderful ECG Masters course. So that is a 3 months comprehensive certificate course in ECG interpretation by CliMed and our other organization, that is World Youth Heart Federation, WYHF India. So this course is going to start on January 12th. Actually January 8th, right? January 8th to March 26th, 2022. So our faculty members are renowned cardiologists and electrophysiologists from multiple hospitals in India. And this course is directed by Dr. Harnees Bhatia. He is MD and DM in cardiology from Savai Mansingh Medical College, Jaipur, and he is working in Metro Group of Hospitals, New Delhi, as a consultant cardiologist. And I'll be taking care of this course for all of you. And the wonderful thing here is the course cost is around 4,999, and we have waived off 100% of the tuition fees for all of you, and we are just charging the technical charges, the certificate charges. That is 299 rupees for 3 months. You just have to pay 299. There is no hidden charges, nothing. You will be paying only 299 rupees technical charges, because this course is coming under our CRS policies. The CRS policies, company policies, right? Companies, social services policies. So this is completely free, 100% tuition fees waived off, just technical and certification charges you have to pay. So the audience, as you know, is the NEET aspirants, MD and MBBS students, PharmD, and all other pharmacy students, and whoever wants to learn. All healthcare students can join. So full brochure will be released very soon. So there will be classes, 12 classes, 12 weeks. Every Sunday there will be the classes. Okay. So there are restricted, seats of 500. And for you guys, I'm telling you, there are only 100 seats remaining. 400 seats are already filled in last 1 week since we have launched it. Okay. As you know, in our cardiology courses, we are already getting, thousands of the registrations. In our first cardiology course, we had 12,000 students, 11,600 students have been registered for our one course. So you know that how we maintain the quality and how much we give to you. So if you are interested, please join our course right now. Okay, there are only 100 seats remaining. So now I'll come to today's webinar, guys. Today's webinar is on Gateway to BCPS, that is Board Certified Pharmacist. Okay, so we have with us Dr. Anita and Sunny. So she is a PharmD graduate. So she was from the 2010 batch, and she is Board Certified Pharmacotherapy Specialist also, and she's working as Neurology Clinical Pharmacist at Department of Neurology, Powai Medical Center and Hospital, Coimbatore. So let me take this privilege to introduce her. She is the neurology She has the neurology specialty experience for last 6 years. She is working in the neurology department, and her area of interest are epilepsy, neuroimmunology, stroke, and clinical research. And she is the in charge of video EEG unit at her hospital and comprehensive epilepsy care center (CECC). And she is actively involved in evaluation, treatment, and follow-up of epilepsy surgery for more than 200 patients with refractory epilepsy. She has supervised the immunotherapy for more than 100 patients with autoimmune neurological disorders. She is improving the stroke awareness among the patients, caregivers, and healthcare workers. She is also into the clinical research with publications in international journals. She has invited speaker. She has been invited speaker for various conferences and PharmD orientation programs. So she has the international experience as well. She has been selected for the internship as part of a student exchange program at University of Toledo, Ohio, USA of 2016. So, okay, one second, just mute some. Okay. Okay, so let me get back. Okay, so and she was the best outgoing student and clinical excellence, and she won the clinical excellence award for 2010 PharmD batch from PhD College of Pharmacy. So with that, I welcome Dr. Anita to this program, to this webinar. So I welcome you, Dr. Anita. Thank you very much for joining us. So if you say yes, I'll go with the questions, Dr. Anita.
Yeah, please. Shall I start it?
Yes, definitely. So, I'll start with the questions, guys, because you have sent all the questions in our, registration form. So first of all, Dr. Anita, I would like to know about your family journey and how did you spend your internship and how did you, go towards the neurology specialty?
Yeah, after passing my PharmD, I really wanted to become a clinical pharmacist. Initially, I had a small interest in this clinical research, but I wanted to stick on to the clinical side. And I was running around asking few of my teachers regarding the clinical aspect of the research, where I can be part of a clinical trial. And then no one had a better idea to guide me. So I thought, okay, I will become a clinical pharmacist and start my work with the patients. So I wanted to become the clinical pharmacist in general medicine specialty, but I had no vacancy in that area. And then I started asking for infectious disease. And at that time, my hospital was not having a vacancy for that particular specialty also. And one particular neurologist with whom I started my career, he wanted a person to do the research work. And so I was posted with him. And then I started my neurology career. But the first question I asked them was, can you please change me from the neurology department? And the answer they gave me was, sorry, we didn't give you a choice, but we have been asked to inform you, just go to the neurology department. And I was really frustrated because all I knew in neurology was just some aspirin, some anticoagulation, and some statin uses. I never knew I could explore this much in this particular specialty. And then I was thinking about quitting this neurology within 1 year of my experience. But again, by that time, I started working with my mentor, Dr. Rajesh Shankar Iyer, and then he opened up all this exploring the neurology was really fun with Dr. Rajesh Shankar Iyer because he guided me like anything. He taught me the depth of neurology, how to approach the neurological cases, and he always told me people thought about this therapeutic nihilism where we don't have much to offer for the neurological patients. But then we came to we started exploring all these treatment options, treating our patients and getting them better always gave me good pleasure. And I knew this is the best specialty where a clinical pharmacist can provide her service. So I continued my journey in neurology and still I'm working happily in neurology department.
Perfect. So, many people have asked about the role of, neurology clinical pharmacist in the clinical setups. We have Ms. Puspanjali Panda and Harini V from Annamalai University, and Puspanjali Panda, she is working as nursing superintendent. So they ask about the actual role and responsibilities of the, neurology clinical pharmacist in the clinical setup and how you are coping up with that.
Yeah, the majority of the cases which we deal with is the stroke. So, most of the neurological cases come with a chronic disability. Most of the chronic condition, the disability they face after they have a neurological disorder. As a neurology clinical pharmacist, I have been educating them, counseling them about their disease and how they can face this battle and how courageous they should be when they are going through this particular disease process. And the important aspect is the medication adherence part. Most of our stroke cases, they don't understand the importance of medication adherence. The terminology of prevention, the importance of prevention, they never understand unless they have a second stroke. And by the time they have a second stroke, the disability is too much. So just explaining about the disease, what is happening inside the brain, what is causing the stroke, and how we can prevent it, what are the risk factors, how this medication is going to help them, and what are we trying to do, and what kind of prevention are we doing for them, how we can improve their quality of life. All these aspects, unless we discuss and explain it in detail in a very simple term, they will never adhere to their medication. And most of our patients, they do tell me, am I audible?
Yes, please go ahead. Okay.
Yeah. So, these patients, when they come to this medication adherence part, it's very difficult for them to understand why they have to continue their medications. Especially when they have a total recovery from their disability, they feel like, okay, I'm fine. Why should I continue these medications? So, what will happen if they stop the medication, getting another stroke and another disability? Whether they will recover from those, uh, like the weakness of their hands and legs, and how it is going to affect their daily routine, unemployment, unable to take care of their own needs, depending on someone else, even for drinking water or having food. All this we have to, it's kind of literally threatening them, telling all these stories about other patients for them to understand what we are trying to prevent. So, the patient education and counseling plays a major role by a neurology clinical pharmacist in providing a patient service.
Yes.
And more than that, I can tell, always the clinical pharmacist is always kind of act like a bridging between the healthcare professionals and the patients. Our physicians, because of the tight or a hectic schedule, they may not be in a position to help their patients. What I mean is, they will diagnose the case and they will provide the treatment. But when the patient is not aware of what their disease is and what we are trying to treat, most of the time they don't receive what they want or what they need. Maybe we are giving them what they want, but what they need is more of the health literacy part. They want to be educated, they want to know what is happening to them. And when we explain it to them, you can see the joy in their eyes. They are so much satisfied telling, we never knew and no one explained this to us. If only someone told this to us previously, we would have taken better precautions and maybe we could have avoided this admission. This is something I hear frequently. And as my patients come back asking for me, they even some patients come and tell me like, we are happy to see you, and even without meeting the doctor, if I can communicate to the doctor what is their current status, they'll be much happy, so they can save some time. So mainly the waiting time and all, it's kind of very difficult for the patient. So acting like a bridge between the patient and the physician, that's the main aspect which we can take care of, especially in the neurology department.
Audible, guys? Hello.
Hello, yeah.
Okay, am I audible? Yes, thank you.
Yeah.
So yeah, so my next question to you, Dr. Anita, is what made you to go for the board certified pharmacotherapy specialist? What was that? What inspired you for that?
My desire to learn more. To be honest, more than getting a certification, I just wanted to learn more. I knew that I had so many dots to be connected. I was lacking knowledge in many aspects. Even though I'm working in a neurology department, it's not like the patient comes with a neurological disease alone. These patients will be having diabetes, hypertension, heart failure, or some other comorbidities, some rheumatological conditions. And unless I understand those diseases and their management, it's going to be tough for me to manage my patients. So the desire to learn more, that is the main inspiration behind going for this certification. And of course, when I looked in for this certification, first thing I asked was why they have not kept a specialty certification exam for neurology.
Yes.
So the answer the BPS gave me was they don't have much neurology clinical pharmacists practicing in US. So even if they bring in this particular exam, there may not be enough people to attempt this. So they didn't
Yeah.
want to bring it until they have good number of people who are working in neurology. So when
Yes.
I went through the content outline in this pharmacotherapy, I knew this is the best one for me. It's like doing MD in general medicine or a small specialty, and then you're trying to specialize in neurology or cardiology. I thought I'll go in the same path. Instead of jumping, we'll go for the basic one, understand the whole diseases. It's basically the same, it's like going through the Dipro, going through all the diseases, learning the anatomy, physiology, pathophysiology, the pharmacology, applied therapeutics. It's like application of whatever pharmacology you are learning, and
Yes.
going through brushing your basics, and then kind of learning to apply those drug basics into your clinical practice. So this was the running force behind me to take this pharmacotherapy certification. And my mentor, Dr. Rajesh Shankar Iyer, he was supporting me throughout during this preparation. After completing each and every topic, most of the time, it's like all the common diseases are seen with our patients. So whenever I complete a topic, I'll be informing my doctor. And when we get a case with that particular disease, we'll sit down and we'll discuss. We'll try to decide a treatment regimen for that particular patient based on their comorbidities. So what are the drug of choice, what are the treatment options available, and what drug can be chosen for this particular patient given the other clinical data. And adding on the evidence-based medicine, going through the current updated literature, what will be the best option for this particular patient. All those daily routine clinical practice and daily discussions help me prepare for this exam also.
Yes, absolutely. So, Dr. Anita, now I'll come to the technical part. So many people, including Muhammad Anwar, Ali Rubi, there are many people who want to know, like, about the board certified pharmacotherapist specialist, and then the benefits of becoming this BCP, and then, is there anything about the process? What are the basic requirements for BCPS, and how to become the, BCPS pharmacist? What are the criteria and what are the opportunities and scopes after BCPS? What is the fees and duration? So I believe that you have prepared the slides for that. So can you please share and resolve these questions of our students? Can you please go for that, Dr. Anita?
Yeah.
I think your video has stuck. Can you please reconnect with the video?
Am I audible now?
You are audible, but your video is stuck, Dr. Anita.
Yeah, okay. Is it visible now?
Not right now, but maybe it will come.
What about now?
No, not yet. Please go ahead with the presentation. No problem. We can resolve this, in between.
Yeah, I think my screen is also not getting shared. The same problem should be there with this.
Wait. Okay, so I think from our side there is no problem because all the authorities have been given to you. Wait. Please go ahead now. Please check now, Dr. Anita.
And still, I'm not getting my presentation.
Can you reconnect? Can you reconnect, please? No problem. You can reconnect.
Yeah. Okay.
Yeah. So guys, we have all the questions. Don't worry. We'll be taking all the questions one by one. Okay, I have written all the questions in my paper. So don't worry, all the questions will be cleared. If not, then you can directly talk. You can directly write your questions and you can directly ask about those things. Okay, she has some technical problem. Just she's reconnecting. Yeah, she has reconnected. Yes, now I can see you. Yes.
Okay, now I'll just try sharing.
Please
okay.
Screen, yeah.
Still, I'm not able to share my window. Maybe I'll start answering the question to save some time.
Oh, what's the problem? This showing?
No, it's like even if I'm trying to share, my presentation is not coming as an option.
Can you try sharing the entire window so you can share the presentation?
Now I have opened my presentation. Is it visible?
No, you have to share the window first. Please go to share screen.
Yeah,
Dr. Anita, you can open your presentation on your screen and then you can put the share screen. Then you can click on that one.
My presentation is open.
Just go there, share.
Okay.
From the Zoom, and you will get some few windows. Now you can share.
Now it is coming. It is coming. Yes.
Yes.
Is it visible now?
Yeah, it is coming now.
It is. Okay. You can just remove this this format background, and you can make the full screen.
You can put the slideshow there down.
Yeah.
Put the slideshow there down. You can just the last option.
Yeah.
This one.
Yeah.
Now is it visible?
Yes, it is visible.
Yes,
but
it's visible.
Okay. Shall I proceed?
Full screen is not visible, Dr. Anita.
Just make the slideshow. Just press it on the slideshow once again. Close the format background.
Yes. Close the format background first, please.
No, down. You can press that cup option.
Yes. And now, now you can
click on that.
Okay.
Click on that down one.
Clicked. I think.
Is it visible now?
Yeah, it's visible. Once again, click on that. You will get the complete screen.
I think full screen is not coming yet.
Oh, just click on that once.
Is it visible now?
It's okay. You can continue.
You can go ahead like that only, Dr. Anita. It's okay if it's not coming full screen. That's fine. We can see the screen at least.
Yes.
Okay. Then I'll just proceed. Let me know if it is not visible. Okay.
No, it's visible. You please go ahead.
Okay. So it's basically from the questions which I received, I found that there was a small confusion between the terminologies or the abbreviations. So the BPS stands for Board of Pharmacy Specialty, and it's a part of the American Pharmacist Association, and they are the ones who are providing the certification, and it's considered as one of the gold standard for determining which pharmacists are qualified for providing advanced practice care. So they do have different specialties in which they provide the certification exam, and you can see most of them which we are well aware of, and few variety or the things which we do not see in India is the ambulatory care, which is where the pharmacists take care of the outpatients. Once the transition of care is done from the inpatient to the outpatient, then the ambulatory care pharmacist can take care of these patients, starting from investigating them, counseling them on medications. They can make changes in their prescription. And whenever they have a medical issue that is to be attended by a physician, they can refer to that particular physician. And so going on, there are more than 10 specialties in which they are providing the certification examination. And this BCPS, this stands for Board Certified Pharmacotherapy Specialist. So what is this specialty exam focusing on? They do give weightage for your academic training as well as the clinical experience you have achieved and how capable you are in providing good uh, patient care for improving their patient outcomes. So you should have a good or a sound knowledge in the pharmacologic as well as the non-pharmacological therapy for each and every disease condition, and how you are going to take care of the evidence-based data available, and how we are going to interpret and extrapolate it for providing a better patient care. And when we practice as a clinical pharmacist, we will be part of the healthcare team where you have the staff, the nurses, the physicians, the physiotherapists, the dietitians, and how good you are in communicating with each and every healthcare professional, and how you are able to improve the quality of patient care. These are the areas where the pharmacotherapy specialty exam is focusing on. So
Dr. Anita, your slides are not changing, I think. Yes, students are telling.
now is it?
No, you can
Am I
close.
audible?
Yeah, you are audible. Your slide is visible, which is, yeah, now, yes, it is. So you can go to
Okay,
the,
so I'll maintain this.
okay.
So this is a small guide for those who are preparing for the BCPS certification. So first of all, you need to check what is your eligibility requirement. Based on the specialty which you are selecting, the eligibility requirements will vary. For pharmacotherapy, they do have different eligibility requirements based on whether you are practicing in US, Canada, or outside US and Canada. So for the Indian clinical pharmacist, we can score based on our clinical experience. So if we have a minimum of 3 years of specialty area practice, and if we have spent 50% of our time, as mentioned in the pharmacotherapy content outline, then we are eligible for appearing for this particular exam. And for that, you have to get an experience certificate kind of letter from your head of the institution. And this is the sample which they have given in their site. And keeping this as a reference, you can prepare one and get a reference letter from your institution, which you can send to this organization and they'll approve it for your examination. And then starting the application process, you have to create a my BPS account, and then they will give you step by step processing requirements. And other than this experience certificate, you have to submit your license as well as your transcript certificate, which they have mentioned clearly how to get those documents. And once you submit this documentation, they will be having a verification process. And once you get a mail telling that you are eligible for this particular exam, you can plan your you can plan when to take up this exam. And starting a preparation, the preparation resources or the process of preparation which have been mentioned in BPS includes going through the journal articles or textbooks or the publications which give you a good idea about the content outline, which means which all diseases are to be covered and what are the updated information regarding pharmacotherapy of these diseases. And even you can attend continuing education programs or specified courses are being mentioned, which will give you more recommendations, guidelines, and updates in each and every disease pharmacotherapy. And of course, you can get some review courses for self preparation, or you can create some study groups and then discuss among yourself regarding uh, these contents. Okay, and you always have to make sure that you work out more of MCQs so that you'll get to know what type of questions come for this exam and how to tackle these questions. So once you prepare for this exam, and when you have scheduled your examination date, this exam consists of 175 questions, and you will have a break in between where 100 questions will be attempted initially And then after that 30 minutes break, you can go for the second set of exam. So it will take around more than 4 hours for completing this particular exam. And within 60 days of the completion, you will get your results. So what are the resources suggested by Board of Pharmacy Specialty? It's like you have this American College of Clinical Pharmacy review courses, or you can go for the American Society for Healthcare Professional review courses. And there are some other organizations which do provide good resources for preparation of each and every specialty. So the pharmacotherapy examination contains 3 domains, and the majority of it is covered by the patient-centered pharmacotherapy, which is a 65% of this particular examination. So it's like you have to learn about each and every disease, the pharmacotherapy, what are the treatment options, what are the treatment algorithms suggested by the guidelines, what are the recommendations, and how you choose the drug of choice based on the comorbidities as well as the clinical condition of that particular patient. That's basically what comes under patient-centered pharmacotherapy. Starting from the anatomy physiology and going through all the pathogenesis, pathophysiology, and then at last coming to the applied therapeutics. That's the entire thing what you learn in Form D and which you're trying to apply in this particular exam. It's like appearing in front of a patient. All these questions looks like a real life case scenario, and it's like a standing in front of a patient and deciding which treatment is best for this patient. That's the same thing what you're trying to do in this exam also. The second domain includes evidence-based medicine and the application of this particular evidence to our practice, and how we are going to educate this evidence-based medicine to the patients as well as the healthcare professionals. That will come for almost 25% of this examination. And then the third domain takes care of the regulatory affairs, the healthcare systems, and how to prevent certain diseases, the immunization part, taking care of the population health. All this comes under 10% of this particular examination. So, as I mentioned, the pharmacotherapy includes all the disease aspects as well as the treatment aspects, and the evidence-based medicine as well as the population health, which also includes some amount of regulatory points also, which may not be applicable for our Indian population, but knowing about how they are practicing the clinical pharmacy there will help us improve our practice also. So this is the content of the exam where you'll have almost 114 questions from domain 1, 44 questions from the evidence-based medicine, and 17 questions will be from the population health. One major thing to mention here is the evidence-based medicine also includes the biostatistics. I'm almost sure that we don't give much importance to the biostatistics during our academic training. But for understanding the evidence-based medicine and for continuing the clinical research, biostatistics plays a major role. So unless you understand the basic concepts of statistics, it might be very difficult for you to learn this particular domain for this exam. So how I prepared and what are the benefits, what are the pitfalls, or what are the drawbacks, more than drawbacks, what are the difficulties in preparing for this exam. That was majority of the question which I got from our audience. So first of all, I have answered why I took up this particular specialty, and I also mentioned how I utilized the time during my rounds for preparing for this particular exam. I had routine case-based discussions on a daily basis. And how much time is required for the preparation? It totally depends on how much you know, based on your clinical experience and based on how frequently you have been updating yourself. For me, as a neurology clinical pharmacist, I had to give enough time for preparation because many of those disease areas I was not practicing it on a daily basis. So, for example, pulmonology was very difficult for me because I was not at all dealing with any pulmonology cases, and understanding the basic concepts, applying the guidelines and recommendation, choosing the patient and choosing the drug for that particular patient based on the current pulmonological status was kind of very tough for me. So it took around 2 to 3 years for me to prepare for this particular exam. As I told you, getting the certification was not my priority, but learning more, knowing more to provide a better patient care. So unless I felt confident that I have gone through most of the content and I have understood the basic concepts, and when I felt like I'm ready for providing a better care for my patient, I thought of taking this exam. And I went through so many feedbacks, reviews by all those people who passed this exam, those who were preparing for this exam, what resources they used, how much time they took, what was their study methodology, and how frequently they used to have the discussions, whether it was tough or an easy exam. All those questions what you're having right in your mind, I too had the same thing, but there was no one to answer this, and I had to go through the profile of each and every BCPS certified pharmacist, and I went through so many blogs and study groups to understand how they were preparing. So that part really helped me to select the particular resource for my preparation. I used the American College of Clinical Pharmacy review package, and after that, I also went through the high yield med reviews (HYMR). From exam point of view, ACCP did a very good job. But for understanding the basic concepts and the in-depth learning happened only with HYMR, because the person who was behind this HYMR, Dr. Anthony Bastai, he did a very good job in explaining each and every disease, the basics of the anatomy, physiology, the pathophysiology. Starting from the very basics, he went on till the pharmacotherapy and bringing in all those guidelines, the algorithms, how to select the drug of choice, that particular criteria he took on. He discussed it very nicely throughout his presentation. So I was really happy with the HYMR content. And what are the benefits of this particular specialty exam? India is a developing country, so as of now, I'm not sure what are the benefits, because I just passed this exam and I have to explore myself from the certification. But I'm sure in future we all are going to benefit from these certification exams. For standing out of the crowd, we need to have something unique, something special among us. Uh, with so many PharmD graduates, if you don't have a unique talent, it's going to be a tough competition for you. So getting a board certification is always an added value to your career. What are the difficulties? The main difficulty in attempting this exam is the expense. It's like it will cost around $600 for you for attending this particular examination, and it's like when you convert it to the INR rate, it will come around 40 to 50,000. And in addition to that, you have to purchase some preparatory course, because just by learning all this pharmacotherapy or keeping the dipro with you may not be helpful, since you need to approach this exam in a specific way. As I mentioned, unless you work out more of MCQs, it's going to be very difficult for you to appear for this exam. Just learning the concepts alone may not help you to crack this exam, because unless you know the type of MCQs, what they're trying to get out from you, it's going to be a very difficult task. This exam, as such, is very tough, and unless you're really prepared for it, it's going to be very difficult. And what is the scope? Maybe I'm not in a right position to tell the scope of this particular certification. But as I told, I'm sure this is going to help you in improving your patient care. It has given me a different perspective in approaching the patient, taking care of my patients. It's like initially we all run behind the case sheets and medications looking for some medication error or for finding out some interventions to do. But more than that, it's like what the patient wants and what you're trying to give, whether it is reaching the patient or not, whether they're benefiting from your treatment or not. All this aspect, how to analyze it, how to make sure the patient outcomes are better after your treatment regimen, what to follow up, when to follow up, what to analyze, when to investigate the patient, and when to talk to them, when to counsel them, what to educate, how to educate them, all these aspects. All these aspects were included in this exam, and now I'm in a better position to take care of my patients. And I feel really happy after learning all these concepts. I learned more than what I wanted to, and it's really a different experience preparing for this particular examination.
Okay. So, yes, Dr. Anita, I think you have something on neurology clinical pharmacist also. If you can tell us about that importance and all.
Yeah.
And then we can come up with the questions.
Okay, so is my slide visible now?
Yes, it is visible. Neurology clinical pharmacist. Yes.
Yeah, so the common neurological diseases which I face is the majority of the cases will be stroke, and followed by the epilepsy cases, Parkinson disease, neuroimmunological disorders, and in outpatient you can see more of headaches, vertigo complaints, and neuropathy cases. So the majority of the patients find it difficult when they have a neurological disorder because of the chronicity of the disease, the chronicity of their medication intake, the recurrence of events, the disability they face because of these diseases, the medication adherence part, continuing these medications for such a long time, and making certain lifestyle modifications to take care of their disease, and some non-pharmacological treatments which they can follow, and the expectations what they have. It's like all of us, including me, if we have a disease, we all feel like getting a cure for that particular disease. But as you can see, very few diseases are cured, and most of the diseases have a chronicity. So explaining it to them, the acceptance part by the patient, all this psychological, the social aspect, everything comes into play where it's very difficult for us to treat a patient as per our need. And since the patients are not in a position to accept that fact, it takes some time for them to adhere to what we are telling.
So,
So
Dr.
if
Anita,
you
I have a, okay, so you're going to some, okay, case.
I'm not going to present any case, but looking into few diseases, I can share what is the tough situation for each and every case as a neurology clinical pharmacist. As I
Yes.
mentioned, for stroke, after the stroke, the disability is the major problem which they face. So telling them about the rehabilitation services, like with rehabilitation only, they are going to recover from their disability. That's one part, and there is no magic medicine to give them, which can help them in their disability recovery. And the medication which we give for treating them, it's just for preventing another stroke. That particular point, that's very important for them to understand, so that they will have a good adherence to their medication. And uh, the like stroke is never considered an emergency by most of the patients. It's something like a brain attack, or you can just correlate it with a heart attack. The same thing is happening inside the brain, but when it is a heart attack, people are worried about their life. And in stroke, it's not like you lose your life most of the time, but the disability, the quality of life comes down, and it's like they don't really worry about another stroke unless they get it and they face that particular disability. So telling them about the primary prevention, the secondary prevention, the medication adherence part is one of the major area, the counseling where I can deal with the patients. And we did a study where we analyzed how many patients were aware about this particular the thrombolysis treatment, and how frequently they were able to come to the emergency department within that window period. We understood the proximity and the awareness of this particular treatment. Everything was kind of a barrier for achieving this thrombolysis in most of our cases. So once the patient crosses the thrombolysis period, it's like what we can offer is only the antiplatelet treatment, which is given for secondary prevention.
Yes.
If we can thrombolyze the patient, it's like we can give them a full recovery. So if you want a recovery, if it is within the window period, there's a high possibility that whatever weakness they are feeling, they might get a full recovery after thrombolysis. So this was one study we could do with our stroke patients, and based on the findings, we are now trying to improve our practice so that the patients have a better awareness, and we can see that change in our cases also. When they are having a recurrence, they are able to come within that window period. So the second set of patients we see frequently is the epilepsy. So dealing with epilepsy case is another. The main issue is like again the chronicity, the what it is. So many myths are there for these patients, and it's very difficult for them to come out of this. Once they have epilepsy, it's not like you always feel confident telling someone that you have diabetes, but you never want to tell anyone that you have epilepsy because you don't want to have an epilepsy attack in front of others. And continuing those medications, it's not that easy because of the fear of these adverse events and how they can manage these adverse events. What can be done for each and every problem? That communication is very much required for each and every epilepsy case. Taking the history, most of the cases which we deal with is a chronic case because they they would have met so many other neurologists and they would have gone through so many treatment, but still they may be refractory, not responding to any drug treatment. It could be because of a wrong diagnosis or a wrong treatment regimen. So getting the whole history, going through the medications which they have been trialed and what response they had, it will take, it's like a 1 or 2 hour time, 1 or 2 hour time to be spent with each and every patient for getting all this detail and planning a regimen for them and telling them how we can help them in bringing down the number of seizures. As I'm working with an epileptologist, he has given me good training for taking care of this epilepsy cases. So just talking to them, counseling them, and making them understand what this particular disease is, how you can take care of them, how you can make changes in their treatment regimens, and especially when the female patients get when they get this particular epilepsy disease, they are all worried about their marriage, whether they can get pregnant, whether their children will be affected with epilepsy. All this kind of beliefs need to be sorted. So communicating with them regarding these aspects is very much important for a better outcome in each and every patient. So we have a comprehensive epilepsy care center which was recently launched in our hospital. So we are trying to take care of the social, psychological disease as well as the we are taking care of the patient in a whole. We are not just trying to treat the epilepsy, but taking care of the patient as a whole. So similarly, we do have Parkinson disease, other neuroimmunological disorders. So discussing the various treatment options and helping them to choose the treatment. It's not like we are deciding a treatment and treating the patient, but it's a kind of interaction, letting them know what are the options and helping them to choose the best treatment for them. So it's like for each and every disease and for each and every patient, we have to tailor the treatment for them. This
Yes.
itself gives you a good area to practice as a neurology clinical pharmacist. It's like endless opportunities. Just to mention, these are the few areas where we can explore yourself and help your patients.
I think you are on mute, Dr. Anita. Your voice is not coming.
No, I have stopped. I'm just giving you the mic.
Okay. So fine. Thank you very much. So my questions here, there are many questions actually, which are, still needs the answer. So my questions are about the eligibility. So, Udavesh Santosh Jadhav from RC Patel Institute of Pharmaceutical Education and Research, and Rahul S. Munoth from DRM Hospital, Mysore, and Dr. Jacinta Seron from Vistas, Chennai. They are having the questions like either B Farm, M Farm are eligible for BCPS, or Dr. Jacinta is working as assistant professor. So is she eligible to go for BCPS?
The basic eligibility requirement they have mentioned is the clinical experience, minimum of 3 years or 4 years for some other specialties.
Okay.
And for as per the US requirements, they do have a 6-year graduation program. So it's like PharmD is accepted because we have a 6-year course duration. So BPharm, I'm not sure whether BPharm graduates can attend this particular exam. But if you have completed the MPharm in pharmacy practice, especially, so in total you have completed 6 years of pharmacy graduation. These people are eligible for this particular exam. That's my understanding. And the people who are working as assistant or associate professors in college, if you have good clinical experience, it should help you to sit for this particular exam. Why? Because without a clinical experience, it's going to be very difficult for you to prepare. Understanding the treatment, selection of the pharmacotherapy, it's not just a theory, but they do give weightage for the clinical experience. If you look into the US criteria, or the people who have passed this board certification, if you look into their statistics, the people who have undergone residency, that's a specialization in this pharmacotherapy, they have the maximum passing score because they have been trained for 2 years in this specialty alone. And then after completing their residency, they are appearing for this exam. So they're trying to equate us with our clinical experience. So minimum of 3 years, that's what they are looking into. So the residency is for 2 years, but our 3 years of clinical experience is being equated. So I'm not sure if you, with your academic experience alone, whether you'll be able to appear for this exam. Even if you're trying to do that, it's going to be a difficult pathway for you because of the lack of clinical experience you have.
Yes, absolutely. Yes. So, okay, one more question, Dr. Anita, for you. Very specific question I have from someone like who did not register to the Indian Pharmacy Council after PharmD, and they have the sufficient experience, in the hospitals and all, in the research and all. So, can they apply for BCPS?
I'm just clarifying that question once again. Did you mean that the people who don't have a license?
Yes.
Yeah, you have to submit the copy of your license when you're verifying your documents. So of course you won't be eligible. And they
Okay.
do specifically mention post-licensure clinical experience is considered. Even like some hospitals do accept, or they, when the vacancy is open, they do take people even before they get the license. Even that clinical experience is not counted for this eligibility. So license is a must. So for license, of course, you have to register with your pharmacy council. So
Okay.
it's a systematic process which they are looking forward.
Definitely. Okay, so my next question is, can you please share the, what was your, what we say, the tricks and, methods to clear this exam? Many people are writing about this.
Yeah, there are no shortcuts anyway. I told you it took almost 2 to 3 years for me to prepare only because I was practicing in neurology, and because of my hectic work schedule, I couldn't dedicate a good time for this particular exam. So if you can give enough time, even 6 months should be enough for you. Like when I went through the people who passed this exam, they are very clear in the part that you have to prepare very well. Like minimum 6 months of time is required for this particular preparation. And comparing the training with the US pharmacist and the training which we receive in India, if they require 6 months of uh, time for preparation, if they require 6 months of preparation, of course, we'll require 6 months to 1 year of preparation based on, again, it depends on how frequently you're updating yourself, how frequently you have been learning all these basic concepts. So it depends on, again, the knowledge you have acquired, what is your stand, how much you know, and how much you have to learn. So after going through the content outline, just see which all are the areas which you are strong in. If you are working in a cardiology, maybe you can skip, or it will be easy for you to learn the cardiology part. I, Cardiology, there are so many topics which comes from cardiology, and if you are a cardiology clinical pharmacist, at least you can save that time. And as a neurology clinical pharmacist, I had to go through each and every topic. And getting a review course is the best option because they will guide you where to focus, what to focus, how to approach each and every question. As I told you, more than learning the theory, uh, there is a method in approaching these MCQs because all these questions will have some kind of clue to the answer. And not all the questions are having single option. Few questions will come with multiple choices. Like you have to select 2 or 3 answers also. So how to tackle these questions is one of the major part in this. And again, learning the clinical part alone, learning the disease and pharmacotherapy alone is not going to help you pass this exam. As I mentioned, biostatistics plays a major role in passing this exam. A few board certified pharmacists has mentioned in their feedback, if you're strong enough in your biostatistics and if you can score a full mark in that particular area, the chances of passing this exam is going to be extremely high. So learning biostatistics is kind of difficult unless you have been into the research. Of course, I think Dr. Ajit, you'll be the better person to comment on that. And I must tell that I'm really thankful to Dr. Rajesh Shankar Iyer, who has been involving me in all the clinical research, starting from the data collection through the statistical analysis. And whenever we plan a statistical method, we used to go through each and every option. We used to sit with the biostatistician for understanding that particular analytical method, why we choose this, what are the different analytical methods available, starting from the basics. So the articles which we published, the preparation of each and every article helped me learn and understand the biostatistics concepts. And then coming to the third domain, which is the population health, I had a special interest in health literacy.
Yeah.
So getting into the depth of the health literacy, I understood it's all about, mostly it's about prevention of the majority of the diseases. For example, recently we had this COVID uh, coronavirus infection, and we all know now how eager we were all to get vaccinated just to break the chain. So, how much this immunization, the vaccinations play a role. For example, these are all part of the population health, and how the health literacy helps us in preventing these kind of disasters. So, it's like it's a daily practice thing what you're trying to learn in a systematic way, and you're applying it in your exam and trying to get a passing score so that you have a certification with you. It's a kind of a daily process. It requires learning, it requires discussions, it requires application into your routine practice. So it's not just like sitting for 6 months and learning the theory alone, but you have to keep applying whatever you learn so that you need not by heart each and every concept, but it comes, it's like an automatic process which happens within you.
Okay, so Dr. Anita, next question is about the exam centers. Do we have to go somewhere out of India, or we can attempt this exam from India? This is the question of many people in our chat box.
Yeah, so when I started planning for this pharmacotherapy specialty, actually it was my desire to do a pharmacotherapy residence in US. Due to
Okay.
some practical difficulties, I knew it's going to be a tough decision, and I wanted to serve the Indian population. So going to US, completing the equivalency exam, getting the license, then going for a residency. After doing all this with a huge expense, then coming back to India was kind of a foolish decision to whomever I spoke this about. So I
Yes.
knew it's kind of a distant dream. And then one of my colleague told me you can write this exam even without a residency, just with the Indian clinical experience. So
Yes.
then I started thinking about this exam, and my plan was to go to US for writing this exam and then come back. So I started thinking about the expense, and then during that time I started my career with again Dr. Rajesh Shankar Iyer. If you see his designation, he has so many certifications and he has done some fellowships. So he told me like all these US exams do have centers inside India. Just go
Yes.
and read about it. So I
Yes.
went through the BPS website, and then I understood, yeah, they do have centers in India, especially in South India.
Yes,
So that
especially in South India, they have been Bangalore, Hyderabad, Chennai, Trivandrum, and if I'm not wrong, there are a few more centers in South India.
yeah, Bangalore, maybe one or two centers are there. Chennai also has some one or two centers. Trivandrum, one center is there. So basically,
Yes.
I'm from Kerala, and I was looking forward to write my exam in Trivandrum. But unfortunately, I don't know, is it because of the non-availability by the time I registered, or whether this particular specialty was not there. But Bangalore and Chennai was offering seats at that time for this specialty. So depending on your locality, you can just search. this exam is conducted by the Prometric, and they will help you to find a better place depending on where you are coming from. So when I put Coimbatore as my destination, they gave me the option of Bangalore and Chennai rather than Trivandrum. But still, I wanted to write it in my
Yeah,
my,
exactly.
but I chose Bangalore due to some personal reasons, and it depends. Again, I'm not sure about the North India where all they have this, but I know Hyderabad, Chennai, Bangalore, and Trivandrum. I
In
have not
North India
experienced.
also they have, in North India also they have, in Kolkata, in Delhi, Gurgaon, Chandigarh, Ahmedabad, Mumbai, and
Mumbai.
there are one or two more, guys. So don't worry about that. Okay, we have a lot of centers in India.
Yeah.
Okay, so my next question is: you were talking about the study groups for BCPS. Those groups, are those groups available for ordinary people who are not registered to the BCPS or who are not attempting for the exam, or that those are only accessible after the registration and all?
No, no. To my knowledge, you can start your own study group and you can invite people to be part of that study group.
Okay,
Personally, I don't know how the study group works, and I have not been into a study group starting from my college days or school days. I always used to learn myself, and I like to share my knowledge, but I don't know how the study group works. But going through the experience by other board certified pharmacists, I have seen people creating their own group. So it's not necessary that you have to register, but even before registration, you can start your process of learning. It's not an issue at all. But finding the right people and getting
yeah.
to know better, it requires some time. So just go through. You have to do some kind of research actually before you start preparing for this particular exam.
Okay, so next thing they're asking about how to prepare for the materials and what kind of materials you have to purchase and what would be the cost of the material. That's very important.
Yeah, the materials come in different types. It's like they do have question banks alone. They do have materials which includes all the domains of the pharmacotherapy. They do have online workbooks. They do have this printable workbooks, and rarely they deliver it in India because of the courier charges and some technical difficulties. We better access for us will be the online version of all these review packages. So as I mentioned, the ACCP and ASHP are the ones which have been, it's not like recommended, but the BPS has stated these two organizations are giving the review courses for preparation for this exam. So I started with ACCP, but I understood that they are lacking few areas, and it's kind of review, you know. So you should be thorough with the basics, and then it's like you're reviewing all those concepts as if you know the basics, and then you're trying to build upon it. So they don't go into the depth of each and every detail. It will give you a good point of view from the good exam point of view. So, what are the main points to memorize? What are the points to be kept in mind when attempting an answer, when attempting a question? Okay, so that's how the ACCP has prepared their material. That's my assessment. But the HYMR, or the High Yield Mid Review, they have done a wonderful job, even though they have not covered the whole topics. The clinical part of HYMR is excellent. If as a person who wanted to learn more, starting from the basics and making, he made sure that each and every disease was learned from the beginning, and then going into the pharmacotherapy part of it. They have done a very good job, and I'm really happy after going through the HYMR content.
Okay, so someone is asking, Karen is asking, or okay, Sarif is asking, is if a person has taken up the residency after PharmD, is it counted in the experience, or do we have to go for the 3 years experience even after residency?
Before answering that question, I missed out on the expense part of this particular review packages. So as
Yes.
I mentioned, if you purchase a question bank alone, it's going to be less costly. And if you go with the full package, which includes the online lectures and some workbooks, and they even provide with some mock exams, which you can take a look into. Like it's like how we are going to attempt the exam with attempting all the 175 questions by keeping a timing for you. Okay. So it starts from a minimum of 4,000 or 5,000 range, and it goes till 30,000, 40,000, 60,000. It depends on how long you want. Is it a 1 month package, 3 month package, 1 year package? So of course it is costly, but trust me, it's worth it. If
Yes,
we can, yeah, if we can find a way for this particular expense, it's really worth it, and it's going to be very helpful for your practice if you really want to learn more. Okay, so coming back to the residency part, uh, so I don't know where this residency was done. Like, is it a residency inside India, or have they done some residency outside? I'm not sure about that part. But if it is an Indian residency, if you can provide a clinical experience certificate, that should be okay. If the residency is counted as the clinical experience, you will be eligible for that particular exam.
yes. Okay, so next question here I'll take about. Okay. Yeah, so Priyanka was asking, is it possible to practice in US after this certification? So I think you cannot practice in USA without, NAPLEX and without, FPG and, without those clinical pharmacy examination.
Yeah, basically, without having a pharmacy license, you can't practice anywhere. So
Yeah,
the
exactly.
easiest license availability is in India. Just passing the PharmD exam will open the gateway for the licensing. Just register in the pharmacy council and they will give you a license. But in US, they do have a systematic process, as you told. They do have an equivalency exam. They you have to pass a TOEFL exam. Then you have to go for internship for a minimum of 1,000 hours, and it can go up to 1,900 or 2,000
Yeah.
hours depending on which state you are selecting. And following that, you have to take up the NAPLEX exam, the jurisprudence part, and after completing this whole process, you will be a licensed pharmacist there. And
Yes.
then you have to get a clinical experience, or you have to do a 2 years of residency, and then you'll be eligible for this particular exam. So comparing that part, maybe getting 3 years of Indian clinical experience was a much better way for me. And after this particular certification, without a license, you won't be eligible for practicing in USA. Still, I'm not sure if you go and get a license exam, whether you see this residency and this particular certification will help you practice inside the hospital. In USA, once you complete the NAPLEX exam, once you are a licensed pharmacist, you can practice as a community pharmacist in a family pharmacy, where they
Yeah.
do all the clinical pharmacist job what we are doing in India. When I went to Toledo for my internship, I saw that the hospital, more than the hospital pharmacist, the family pharmacist or the retail pharmacist are enjoying their work because they do have a good communication with their own patients. They take care of the patients in a very good manner. Inside the hospital, it's more like a healthcare professional interaction, taking decisions for the patients, but the interaction with the patient may not be that as expected as in India. So there is a difference in practice when you call the clinical pharmacist in India comparing with the clinical pharmacist in USA.
Yes. Okay, so thank you, Raghukiran sir, for joining in the YouTube. And I'll take the next question about the recertification. Karen is asking about, can you tell about the recertification?
Yeah, so once you're certified in a particular specialty, the certification is valid for next 7 years. So after the 7 years, you have to renew it by taking up a recertification exam, or you have to earn certain credit points as mentioned by the Board of Pharmacy Specialty. I have not looked into it in detail since I have another 7 years for that. So I thought I'll slowly get into that part. But recertification is done after 7 years of your first certification exam.
Correct, correct. Okay, Ajmal is asking about the internship count as experience or it is post registration. So, internship of family does not count as the experience for certification at all. Ajmal,
Yeah.
okay, as Dr. Anita had just told. So, okay, can you just repeat, Dr. Anita, about the minimum qualifying percentage in the exam?
Yeah, so the passing score required for this particular exam is 500 marks. So they tell like it's a 200 to 800 scoring, and the minimum is 200 and the maximum you can achieve is 800.
Okay.
And if you have a passing score of 500, you will be taken as a certified pharmacist.
Okay, great. So, guys, if you have any questions, you can ask. Dr. Sandeep, you want to ask some question? Dr. Sandeep is, joining us in the Zoom meeting. Dr. Sandeep, you want to ask some question?
Yes.
Yes, please, Sandeep, go ahead.
Actually, I'm trying for the materials from many days, and for this, and I also contacted you through LinkedIn.
Yes.
So I just want to ask the materials and the question banks, where it is available, the links and all for that.
Yeah, if you get into the BPS website, you can have the direct link from ACCP and ASHP. And for the other resources which I mentioned, like Med 101 and HYMR, you can directly get an access. Means once you get into their website, they'll be giving the full details regarding what are the different types of packages, how long you can have, and the expense for each package based on the duration of course you want to take up. There may be other resources also, I'm not sure, but personally, ACCP should be enough for you from the exam point of view.
Yes. Okay, so Dr. Anita, Dr. Suham has a valid question, very nice question. Clinical experience of 3 years for this exam must be from one organization or can be counted from one or more organizations as well?
Yeah, I too received this particular question. So it's like they just want 3 years of clinical experience. So whether it is from a single institution or not, it doesn't matter. So what you can do is either you can ask your current institution to support you in this particular area, or maybe you can get a 2 different clinical experience, so that combining it you can show the total of 3 years clinical experience. It depends on your institution head whether they are okay to support you in that particular matter.
Okay, so Sanika has one question here. I mean, it is kind of out of league question, but I'll still take it because she has written it multiple times. In the career point of view, which will be providing good growth, MBA in healthcare or MBA in hospital management or BCPS? So for your information, Sanika, BCPS is just a board certification, not the degree, and MBA would be the degree, and it would definitely, add on more value to your CV, and it will be again the master's degree in the business administration, whether it is in healthcare or whether it is in business marketing or anywhere, but it is add-on degree to your certifications, to your things. But BCPS is just a certification which shows you that you are specialized in some what we say, some stream of medical sciences like neurology or cardiology or pharmacotherapy or emergency medicine. That will just add on that you are having the additional special qualification, special skills in this special stream after your PharmD. So you can take care of those specialty patients, but this is not some kind of degree or diploma. That is just a certification. So you want to add on something to this, Dr. Anita?
From my understanding, MBA will help you to get into more of administrative role, and passing this BCPS exam will help you improve your patient care experience.
Yes.
So it's like improving your service as well as improving the patient outcome. That's what we are trying to gain from this particular certification. And from MBA, it's going to help you in your promotions, promoting yourself as an administrator, and then leading an organization or leading a particular group of people.
Yes.
So this is a difference, like whether you want to be with your patients or whether you want to lead your people towards better patient care. That's two different aspects, which is, I think it's not comparable, but as Dr. Ajit told, it's like it's a degree and this is a certification.
Yeah, exactly. And similarly with the PhD, Meghna, PhD is one of the degree and additional doctorate for your, certificates and CV. So there is no comparison of BCPS and PhD definitely. Okay, Abdullah has one question. If we do BCPS, is there any chance in pay increase while working as CP in India? Okay, so that is my question also to Dr. Anita. Dr. Anita, what is the increment in your pay? I mean, don't tell the exact amount, but is there any effect on the payment?
I just got my results few days back. I have not yet received my original certificate. So I'm not in a position to ask for any promotion or any increment. So
Okay.
after receiving my certificate, maybe since there are very few people who have passed the certification exam,
Right.
exactly three clinical pharmacists in India has passed this certification. One in
Yes.
infectious disease last year, and two
Yes.
in pharmacotherapy that was in this year.
Yes.
So maybe we'll explore more, and we'll be able to create a path for the upcoming board certified clinical pharmacist,
Yes.
and give us some time to create something new and uplift our profession with more and more board certification and other degrees to add on.
Guys, I want to add to this. She has, pointed a very, wonderful topic, that, the new things. So I'll tell you about the PharmD. Only PharmD is very new course in India. It has started just in 2008. Only 14 years if you count. 14 years is nothing. Okay, I'm telling you, there are only 6, 7 batches who have passed, and we still are looking for the scopes and opportunities, good opportunities after PharmD. As I always tell in all my webinars, all my, student interactions, you are the one who will explore the scopes. You are the one who will, set the new opportunities for upcoming generations of PharmDs. So don't worry about the scope and opportunities, because you are the one who will create the scopes. My friends, my juniors, my students, they are working in the field of machine learning, artificial intelligence. They are in the government sector. They are drug inspectors. After PharmD, I'm telling you guys, after PharmD, okay, they are in the technology. They are in the hardcore, marine science. They are in the hardcore food industry. Okay, they are in the medical writing. They are in the regulatory affairs. They are medical license. They are medical advisors in pharmaceutical companies. That post was, especially what we say, locked for the MDs and MBBS. Now PharmDs are ruling on those positions. So it is just your, capabilities. These are just your, competencies, which will open multiple ways, multiple scopes and opportunities for you. So similarly, this certification in India is very, very new. Only 3, as Dr. Anita has told. Last time we have, called our infectious disease specialist also to this webinar, to one of the webinar, and you got interacted with her also. And today Dr. Anita is with us. So we are, getting more and more people, and they are guiding you. They are, giving you the insights of those exams, and how you can become the special, how you can become the special among all. So these are the new things, and you are the one who will set up, the examples, who will set up the way for your upcoming generations, in PharmD. So don't worry about that. Just go for something new. Go for, these things out of the box. You have to think out of the box. Just don't become the clinical pharmacist. I'm saying don't become, means should be specialized. You go for some special things in that. Clinical pharmacist is normal. After PharmD, you can join any hospital. You can get the 15,000 to 25,000, 30,000. But go for some special skills. Go for some special streams. So you can, pave the path for your upcoming generations, upcoming, juniors, super juniors, and who are going to join the PharmD. So they can get inspired, and they can, feel like they are in the safe course. They should not feel that they have done some mistake, or, they are in the, the wrong stream, or they're in the wrong course. So you are the one who will create the opportunity as scopes for that. Okay. So I'll take one or two more questions. Okay, Dr. Naveen. Naveen has some question. Many hospitals in Kerala are not providing a specialized department experience as for now. Many pharmacists are working in OP and IP settings. So how will this affect the BCPSC? Lack of resources is everywhere, not only in Kerala, it's everywhere around India. And, not only in India, outside also. So only some multi-specialty hospitals have the multi-specialty exposures to the students. And some hospitals, if they have also, they do not expose, those departments to the students. So select your hospital wisely, and if you are not getting where you are posted or something, then after that, if you want to get exposed to that particular department or your area of interest, just go for it anywhere in India, anywhere in your town, state, anywhere, wherever you get the chance, please go for it. So
it's like whether you are posted in a particular specialty or not, the main concept is whether you are dealing with the patients or not. Let it be in the
Correct.
outpatient department, let it be the inpatient department. The
Exactly.
communication which you have with your patient and
Right.
taking decisions for your patient. This is where the clinical experience counts. The word clinical, it's standing for the what it is, the interaction with your patient. It's simply the interaction with your patient. It's a bedside thing which we are looking forward. So even if you are not in a specialty, but you have been posted in a particular ward, that's what I'm seeing in most of the hospitals. So what they feel is like, I'm not able to focus into one particular disease area, or I'm not able to get good experience. It's not like, it's actually kind of difficult to take care of all the patients, but still you can find your own opportunity with those patients. Treating different kinds of patients, just take it as a general medicine kind of experience, so that you have so many patients to deal with. You can go through each and every disease state. You can do your medication reconciliation. You can talk to them regarding the disease what they are having now, how you are going to provide a better patient care. So it doesn't matter whether you are in a specialty or not, but if you are working clinically, you will be eligible for this BCPS or this any certification exams. Unless you are
Yes.
going for a specialty like cardiology or infectious disease, or maybe critical care pharmacy, it's better that you're working in that particular specialty. But for pharmacotherapy, it includes all diseases, which is a plus point for you, whether you're in a specialty or not.
Yes. So see, guys, I'll just take you through just 2 minutes. I'll take you through the BPS Board of Pharmacy Specialist website. This is the website, bpsweb.org. And if you want to see the specialties, you can just click on the menu home about BPS, impact of certification, BPS specialties. Click on BPS specialties, you will get all. Ambulatory care pharmacy, cardiology pharmacy, critical care, compound, sterile preparations, emergency medicine, geriatrics, infectious disease, nuclear, nutrition, oncology, pediatrics, pharmacotherapy. There are the additional qualifications. There are some added qualifications, psychiatric pharmacy, solid organ transplant pharmacy, and all. Okay. And exam information you will get here. Okay. And after that, you have all the things, about the material scoring process, exam day, exam content, and sample examination things, and preparing for the exams. Everything you will get in the menu. And if you look at the 2023 examination certificates dates, you can see here 23 BPS examination dates are mentioned here. So April, May 23. So the registration window will open on January 4th. Okay, and the testing window will be from April 3 to May 1st. Okay, and these are the dates for August and September exam registration. So you can go for I think, Dr. Anita, twice in a year you can go for the examination, right?
Yeah, for most of the specialty they offer twice, and now they have made some changes in few specialties because of the increasing number of people who have been appearing for this exam. They have introduced a continuous exam process where they can register at any point of time. That's what I understood from that side. They can
Okay.
register at any point of time and they can take up this exam. It's not like specifically for these particular range of time. And regarding the added qualifications which you mentioned in the pharmacotherapy specialty, initially they used to give infectious disease and cardiology as an added qualification. But now,
Yes.
since they have brought it as a separate specialty exam, I
Yeah.
think they have taken out that added qualification criteria. So you can appear for the infectious disease or cardiology exam separately, and you can get that certification separately. So you can keep it as a BCIDP or BCCP certification, or that particular designation can be mentioned with your name.
Yeah, absolutely. So any other questions, guys? Any other questions do you have? Sadia, you want to ask some question? Okay, so we have with us Sadia Mushtaq from Pakistan. So if you have, Sadia, some questions, you can talk to Dr. Anita. Okay, her mic is not on. So just ask about the materials that we have discussed already.
I would like to answer, like I received few questions. One of the question was like, what is the value of PharmD specialist in India and how the doctors treat PharmD doctors in India?
Yes.
That's a very
Very
tough
valid
question to
question.
answer. Thankfully, with the blessings of God, I had good supporting doctors throughout my career, starting from the day starting from my internship time or the clerkship time, that is a fifth year PharmD. All the doctors were really supportive, and they always looked forward to train us in a very good manner, so that we'll be in a better position to provide patient care, good patient care. Okay.
Yes.
So my doctor, he, as I told you, he's a neurologist come epileptologist, and he has gone to an extent where he has shared all his epilepsy knowledge with me, and it's a kind of privilege because there are very few epileptologists in India, and getting a special training in epilepsy. During my PharmD days, I remember epilepsy was Greek and Latin for me. So I can't believe that I have been meeting and taking care of the epilepsy patients so nicely now. I'm confident to take care of all the neurology cases. So don't feel bad or sad if the doctors are not supporting you. Just try communicating with them. Just tell them what is your role. When I started my career, the initial 2 weeks of my employment, I was just sitting simply inside the OPD. And what I did was just taking the papers of the patient files, and giving it to my doctor, just moving my patients in and out. So I was thinking, like, after 6 years of course, is this what I'm trained for? Then what am I supposed to apply? Why did I come to neurology? All these questions were going on, and I was almost about to resign my job. And then I was like, okay, calm down, just give it some time. Just talk to your doctor. What will happen if you talk to your doctor? So
Yeah.
I asked some time for with him. I explained, this is what I studied, this is what I want to do, and this is my qualification. This is what I am capable of. And I took all the printouts I could get in my hands from the American College of Clinical Pharmacy, from here, from there, from all the roles and responsibilities. I just gave it to my doctor. He was very kind enough to go through each and every page, each and every word in that particular paper. And then after 2 days, he came back and he introduced me. He told, this is a new course in India, and this is what these people have been trained for. So let's utilize them for better patient care and outcome.
Absolutely.
So
Yes.
it's just a matter of time, just a matter of discussion with your doctors. Just wait for that time. Okay, don't feel sad or frustrated thinking your doctor
I,
never supported you.
I will add to Dr. Anita, but in a different perspective, guys. My concern always with you is, please leave the ego. Please leave that perception of comparing yourself with doctors when you are going to meet a doctor. Okay, you are the helping hand to the doctors. You can help the doctors in betterment of the treatment for the patient. You are the part of the healthcare team. So just don't compare yourself with the doctors that you are also getting the doctor degree. Just always differentiate between the streams, always differentiate between the courses. You are the clinical pharmacist. You are the person who will look into the medicines, who will look into the prescriptions, who have the rights to audit the prescription which is written by the doctor. Okay, so just don't compare yourself, just leave the ego when you are going to communicate to them. Okay, communicate with them. So always go humbly, ask them for that. No one, I'm telling you with the guarantee, there are only few who are stubborn, who will not entertain you. If you are capable enough, if you are competent enough, you are humble enough, everyone will entertain you and everyone will understand that what you are actually and what you can do. Okay, so that is the special mantra, and that is the very common mantra for all of you from my side. Be humble and go with your competency. Tell them what are your job responsibilities. Just don't go with the ego, like, oh, if they are not considering, then why we should go. Okay, and use your internship as much as you can. Don't feel like internship is a free time for you. You will just go, sign, punch in, and go and enjoy your life, because no one is there to look after. There is no assignments, there is no exams after internship. Okay, these are the two things. If you keep in mind, I'm very sure that you will be one of the successful clinical pharmacist one day, and you will be the role models for upcoming generations.
Once you express your desire to learn and involve yourself in the patient care, I'm sure all the doctors will be happy enough to share their experience and teach you for improving
Absolutely.
knowledge and your experience. So
Absolutely. Absolutely.
just be open for learning anything and everything which you receive. just not the drug part alone. Just don't go with the mind of doing some intervention and finding the medication errors, which of course will irritate anyone. Even if when you are practicing as a clinical pharmacist, you will have to meet other clinical pharmacists who might be pointing out your errors. So it doesn't
Absolutely.
mean that you are inferior or superior to anyone, but just try
Absolutely.
to accept what they're trying to show you. Just have an open heart to learn more, to acquire more knowledge. That will help you for your own growth. So
Yeah.
the ego part has to be settled. That's a very good point.
Yeah. And you are the part of team. You should not have any competitive behavior with them. Not at all.
Actually, in US and all, the PharmD people with the specialty certifications, they do practice as drug consultants or independent pharmacy practitioners. And what they do is, once the physician has diagnosed the disease, the patient is being given to the pharmacist, and the pharmacist take care of these patients. So they have the right to prescribe, they have the right to investigate the patient, follow up the case, and the patient will be referred back to the physician when they require medical attention. Maybe by hospitalizing them. In those situations, they give the patient back to the physician. So it's not like we are trained well enough to take care of the patient in a whole. We are part of this healthcare team, and we have to provide our service based on our training and our specialty. So unless we have a teamwork, we are not going to gain anything, and we are going to provide a very bad service to the patient. Okay,
Yes.
so teamwork is very much required in our profession.
And if you feel that you are not having the rights what Dr. Anita told in India, you have those rights. See, you can open your counseling clinic. You can open your pharmacy clinic where you can counsel the people about the drugs. You can audit their clinic, audit their prescriptions, and you can. If you find real genuine mistakes, you can consult with the doctor. You can talk to the doctor and you can tell them with the valid justifications. You can tell them to change the medicine. So if you have that guts, if you are empowered enough to do that, if you are you know competent enough to do that, there is no one to stop you in India as well. Okay, so do that.
Endless opportunities are coming up in India as our countries are in the developing pathway. And since PharmD is a new course, and since we are specializing in each and every specialty, of course, the opportunities are going to be open both in hospitals as well as in the industrial sector.
Yes.
So just keep on looking for. First of all, you have to identify what your interest is in, whether you want to be with the patient or not. If it is with the patient, just start with the clinical pharmacy career, and maybe even clinical research will also help you to be with the patient. But instead of practicing as a clinical pharmacist, you can work like a clinical research coordinator or in that sector. I'm not a person to comment on that part since I am not well aware of the opportunities, but they do have good packages, both your job wise as well as your salary wise. And then those who are not interested to work with the patients, you can even make a shift in your career. Having a clinical experience is always an added advantage uh, in your career growth, whether you're shifting to the industrial sector or whichever way, it's always an addition to your career growth. Okay.
So if no more questions, then we can wind up because it's 9:05 now. Guys, if you have any questions, please write up. We can take. Otherwise, thank you very much for joining. And my special thanks to Dr. Anita, who has, spared 1.5 hour almost. And, she was preparing with us for last 2 days. We were, referring all the questions to her. We were, because we got many questions from the audience, and that was the best thing, that we got the questions in advance from you guys, so we could clarify those in advance and nicely in the proper way. So thank you, Dr. Anita, for joining us for this wonderful insightful webinar, and providing your experiences, sharing your experiences with our students, with our academicians and clinical pharmacists who are joining today through the YouTube. And there are, I think, more than 700 views right now, and there were around more than 200 participants. At the ones, there were 250 plus participants who were joining live. So thank you, Dr. Anita, for joining us.
So just 2 minutes for Thanksgiving. So I would like to thank CliMed Research Solutions and Dr. Ajit Singh. Your profile was really inspiring. And thank you for this opportunity for interacting with the budding clinical pharmacist as well as the upcoming PharmD graduates. And I would like to thank my parents, my teachers, all my gurus throughout who supported me for this upliftment of the career, those who supported me throughout my education, and who has been constantly supporting me right now also. And thanking God for giving me all this opportunity to specifically mention the Dr. Rajesh Shankar Iyer, with whom I am working now, he has been a constant motivation and an inspiration for me. Looking into his degree, he always wanted to learn more, and he made sure that I also learned throughout this process. Each and every day, he allowed me to spend some time for discussing my MCQs and discussing all sorts of doubts, kind of discussing all the disease basics. He taught me about each and every disease, what is the anatomy, physiology, which I was very weak in that part. So without, as I taught, without the basics, it's very difficult for us to learn the pharmacotherapy. Okay, so thank you all for patiently listening to my stories and my experience in preparing for this exam. And I'm looking forward for people to do either the certification or finding something new and doing something unique, and explore yourself, enjoy your time you work, enjoy the time you're working, and please don't feel bad or frustrated with uh, the difficulties you face. Without these challenges, you are not going to gain anything. So learn from each and every situation, learn from each and every patient, learn from each and every case you are dealing with. Okay.
Yes, and Dr. Anita, if you allow me, can I share your LinkedIn profile with the participants? They are asking for your LinkedIn profile so they can connect with you, in LinkedIn or somewhere in the social media.
Yeah, sure.
Okay, so thank you guys for joining. I will share Dr. Anita's LinkedIn profile with you. And so sorry, I think I did some mistake here. Okay, so thank you guys. I'll share those things with you in your chat box right away, and you can join us, Dr. Anita also. Okay, on the LinkedIn, and you can contact her. So let me search. One sec.
I'll be happy to help you people. Even if I don't reply in a few hours or 1 or 2 days, please be patient. Whenever I'm getting into the LinkedIn, I'll reply you. And I hope I won't be getting repeated questions. But again, feel free to ask for any help. I had my own difficulties in preparing for this exam, so I'll be really happy to help you whichever way I can. Okay, and especially
Okay.
for the pharmacotherapy specialty, I have been receiving questions regarding the nutrition and other specialties for which I am not the right person actually. Starting from the resource or the method of learning, I don't know anything about that specialty. So I'm sorry that I'm not in a position to guide you people. But maybe if I know someone who have done or completed that certification, I'll help you to get in touch with those people. That's the best
Okay.
I can do.
Yes. Thank you guys. So thank you very much. Have a good night and take care. Thank you, Dr. Anita. Good night.
Thank you. Good night.
Good night, Sandeep. Good night, Sadia. Thank you.